And
well, that actually leads us nicely into a question from Stuart, who says, could you run quickly through what your screening process is for TMJ?
Yeah, sure. So, of course, a bit of subjective history. So you want to know if there's been any trauma. You also want to know what dentistry they've had, because if they've had teeth pulled, then that increases the risk. You want to have a quick look at their facial profile.
What do you find are the most effective treatments for TMJ? That might be quite a lengthy answer, I imagine.
Yeah, it's tricky to say, but I would say it's a combination of manual therapy is probably more palliative in most cases. It's going to support what a dentist, TMJ specialist would do, but in some cases it can be restorative or corrective. It depends what's driving it. And so, if you're doing your manual therapy, you're working on their posture, you're working on their nutrition, working to decrease sensitization. If that's present, then you can have a tremendous effect without a TMJ specialist present or involved.
There are some acupuncture points which are used for TMJ problems.
And interesting enough, they're right through that posterior temporalis region that they tend to, there's a whole bunch of acupuncture points and acupressure points right around here.
And I think there are some on the pterygoid themselves, aren't
there?
Yeah,
there are.
To reduce the tension, presumably.
Definitely. So you can certainly reduce people's pain dramatically, and things like mid-face pooling. So one of the symptoms of TMJ dysfunction is that people get big bags under their eyes, and that's because the maxillary veins drain through the masseter. So if you're holding your jaw tight, if you've got any kind of bruxism, then of course that means that it locks down on that maxillary drainage, and then you wake up with big bags under your eyes. So that's why stress does the same, because you've been clenching your teeth. That's also why gut issues can do the same as well. So a lot of people with parasite or fungal overgrowth, they'll have big bags under their eyes for the same reason.